Hi everyone, this is Dr. Brett Carey. I'm out in my garage making hand splints on my 3D printers for my patients. But I did get a text from a patient who's currently overseas, and they had a question where they've been feeling dizzy and they want to know, do they have positional vertigo or do they have another type of vertigo, and what should they do? So if you have vertigo, if you feel dizzy, here's what you want to think about before you try any of the repositioning techniques like the Brandt Daroff or the Epley maneuver that you'll find on YouTube. There's tons of videos like that. The first question I always ask patients is, are you actually dizzy or are you motion sensitive or lightheaded? And that's very, very important because people use the term vertigo very generically. So if you're lightheaded or you're motion sensitive, that's definitely a different thing than if you're truly dizzy. And as far as whether or not you should try the repositioning techniques that you'll find online, whenever I talk to a patient that is somewhere remotely, I always ask them, can you make it worse? Can you move in any different way to make the symptoms come on? If the answer is yes, then the likelihood of the repositioning techniques working is high. When someone comes in and they say, you know what, I'm dizzy no matter what, I can't make it better, can't make it worse, that's usually a different type of vertigo, and that's going to take some investigating to figure out if it's labyrinthitis or an irritated cranial nerve that connects to the ear, or if there's more of a central cause, something to do with the brain itself. So in summary, if you go ahead and you turn or move a certain way and you can make yourself dizzy, and generally that dizziness resolves within 1 to 30 seconds, then yes, try the repositioning techniques online. The other question I get a lot is, if I'm not sure what ear it is, should I try the repositioning techniques? What I tell patients is, ultimately, the side that you sleep on, if it is positional vertigo and it is the common posterior canal, it's likely that if you sleep with your left ear down, for instance, it's your left ear that is the problem. So otherwise, what we know is that even if you try the repositioning techniques for the wrong ear, if you do it quickly enough, you'll likely still create enough momentum to fix the problem. So I hope that's helpful. Of course, when in doubt, go to the emergency room or urgent care or speak to a healthcare professional.